Good afternoon. My name is Stacy Walker, and I serve on the Linn County Board of Supervisors. I'd like to start today by acknowledging some rather difficult news. 2 members of our Linn County community have died from COVID-19, and we know that as this crisis wears on, the number of deaths will increase. The family members of these individuals can't assemble to pay respects. Many friends and families were not able to say goodbye. And it is for these reasons that we are all working so hard, making sacrifices so that we can prevent as many deaths as possible and get through this challenging time as quickly as possible. As of now, and the numbers are seemingly changing by the hour, there are 71 confirmed cases of COVID-19 in Linn County and over 400 cases statewide. We know that these numbers do not represent what is truly happening in the community, given that testing is limited and many folks who are experiencing mild symptoms are being encouraged to self-isolate at home. What this means is that the virus is spreading through our community at a pretty good clip. And although we are unable to know exactly just how many people are infected, we can assume that the number is high and will continue to grow. But that is where our assumptions should end. We must now move to more direct action as we confront this crisis head on. Over the weekend, we had several hospitalizations due to COVID-19, and there are a few individuals on ventilators in critical condition. And while our hearts break for those individuals and their families, our resolve should be strengthened. Everything we do now matters. We cannot overreact. It's impossible to do that. These calls for social distancing and sheltering in place must be viewed as essential to the preservation of life. If we do this right, we will look back on this time and criticize our leaders who pushed for doing too much or moving too swiftly. This is the side of the equation I'm willing to err on, doing too much to save lives as opposed to doing too little and losing more folks in our community. These decisions are never arrived at easily. We understand the toll this is taking on everyone, including our business community. And while our cities are doing a great job of developing a recovery strategy, it's worth noting that sick people can't work jobs, and we can do our best to revive the economy, but we cannot revive a person once we've lost them. We are all tied in this together. This is about shared sacrifice. Now, as fate would have it, today is Doctors' Day, a nationally recognized holiday where we honor the women and men who don white coats and take the oath to be of service to others at all times, but especially in times of great need. And while we know our doctors hold a special place in our hearts, there are so many others on the front lines who deserve our recognition. Our nurses aides, our first responders, our technicians, social workers, mental health professionals, our public health officials, and so many more. They are putting their lives on the line for us every single day. Now, the best way we can honor them is by doing our part to slow the transmission of this virus by enhancing our social distancing efforts and sheltering in place when we can. Finally, the first of the month is approaching, and we know that this crisis has proven to be a financial burden on many. There are federal provisions, statewide and local provisions that protect individuals from eviction during this time. There's even help for folks who have fallen behind on their mortgage. My message to tenants: know your rights during this time. Iowa Legal Aid can be of assistance to you. And my message to landlords: do the right thing. This is about shared sacrifice, and if you know a family is struggling between putting food on the table and keeping a roof over their heads, extend them a little grace as we work our way through this. Thank you.
Good afternoon. Dr. Tony Myers, Vice President of Medical Affairs at Mercy Medical Center. Supervisor Walker did a really good job of kind of setting up where we are right now. And I'm going to kind of go through some things quickly to try and get everybody to understand how critical of the time is that we're in right now. So we've talked over the last few weeks a lot about increasing capacity of the hospitals, increasing beds, ICU beds, ventilators, protecting our staff. And I have to say also thank you to our staff. I know that the community is under a lot of stress right now. The incredible work and courage that I'm seeing every day at the medical staff is, we'll look back on this and see what heroes they are. But to sort of state where we are right now and how critical of a time this is, everybody wants to know when's this going to peak, when's it going to end, how bad it's going to get. Looking at the data that we've had over the last few days, last week in Cedar Rapids, we can start to see where we are on a curve, but there's no way really to predict exactly how bad it's going to get. We know it's going to get worse. It's really impossible to predict based on our local data of exactly when it's going to peak. So we have to rely on other data sets across the country and across the world as to what happens when places get to where we are right now. What those data sets would suggest is that this will peak in Linn County in the next 3 to 4 weeks. So all of the things that we've been doing from washing hands to social isolation to what the governor has done with closing schools and businesses, all of those things are important on what's going to happen in the next 3 to 4 weeks, but really where that peak is, and this is a critical thing, is what we do right now over the next 10 to 14 days is going to determine how high that peak is, how bad it gets, and whether all of the things that we've done in the hospitals to increase capacity, whether we're overwhelmed or not. So why is that? If you look at the cases right now that we have in the hospital, most of those they were infected somewhere between 7 to 10 days ago is when the lag between when they get to the hospital, especially when they get critically ill. So if you think that the peak based on other data sets is going to be 3 to 4 weeks from now, what happens in the next 10 to 14 days, how much we can prevent each other and ourselves from becoming infected is going to determine where that peak is and how bad it is in 3 to 4 weeks. There's some things that we're doing at the hospital right now, so just so people are aware, when you come to Mercy, that everybody there will have a mask on starting tomorrow, everybody that can tolerate it. And that's, we're saying that's our Protect Our Neighbor campaign. And so this isn't necessarily PPE that you're interacting with patients. This is masks, homemade masks that people have made for us, over 4,000 of them. So billers, everybody that doesn't have direct patient care will be wearing a mask, and that isn't so much to protect yourself as it is to protect your neighbor. We should assume right now that any of us, multiple people in this room could be infected. And so it's about keeping that distance, but also putting that mask on as a show of support to keep our neighbors safe. There are other things that are going on, obviously, and I'm sure I'll have the opportunity to answer some questions here in a few minutes. That's all I have right now. Thank you.
I'm going to lower this mic to see if we can get rid of the feedback. Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. Today, the Iowa Governor's Office announced a second Linn County resident has died from COVID-19. Our hearts go to the family, the friends, and the caregivers, to the Linn County residents who have died from this illness. The second individual that has died is an elderly adult that was over the age of 81. Additionally, with 29 new cases in Linn County, the total number of Linn County cases is now at 71. Linn County now has the most confirmed COVID-19 cases and deaths per county in the state. Unfortunately, 21 of these cases are associated with a local long-term care facility. The Iowa Department of Public Health and Linn County Public Health are working closely with this facility to assess the needs of the facility, staff, and residents. We are encouraging all healthcare providers at all levels of service to stay home when ill. This is especially true for those that work or interact with vulnerable populations, such as older individuals, especially those older individuals with underlying health conditions. For all Iowans, you must stay home to stop the spread of COVID-19. If you are feeling well, you need to limit your interactions with others as much as possible. Avoid shopping trips and social visits that are not necessary. Children need to avoid sleepovers, playdates, and outings with friends. We understand that this is difficult. However, children could possibly take the virus from one household into another. Iowans should only go out to get essentials, such as groceries, medications, and other supplies. When available, use a drive-through, a pickup service, or delivery. Additionally, Iowans that are ill need to stay home. And I don't know how many times I have said this or how many times I need to repeat myself. No matter how mild your illness is, stay home. Do not go to work. Isolate yourself from others. Do not resume activities until you have met all 3 of the following criteria. You've had no fever for at least 72 hours. That's a full 3 days, and that's without the use of fever-reducing medications. And your other symptoms have improved. For example, cough, shortness of breath. And finally, it has been at least 7 days since your symptoms first began. All 3 of those need to be met before resuming any activities outside of your home. If you have an emergency, call 911. However, for all other illnesses, no matter what that illness is, call your healthcare provider or an urgent care first. Do this before going to the emergency room. We need to work together to ensure that our emergency services are being used for real emergencies so that we do not place a burden on our healthcare system. We will get through this together. However, the actions we take now will determine how quickly we get to the other side of this pandemic. We are Iowans. We come together during disasters. We care for each other during times of trouble. We celebrate together during times of joy. We need to use that Iowan sensibility now to protect ourselves and to protect each other. This is a marathon. This is not a sprint. We understand that this is a time of stress for many, and we're talking a lot about physical health, but we also need to remember our mental health. As we continue on this marathon, if you need help, you can call 211 or the Foundation 2 crisis line at 319 362-2174. This line is for everyone. More information regarding local mental health services is being added to the Linn Area Partners Active in Disaster website. We work closely with our community partners and have a message on behalf of Linn Area Partners Active in Disasters. Quick read thermometers for mental health and child care providers are still needed. Donations of these thermometers can be dropped off at the HACAP corporate office, which is located at 1515 Hawkeye Drive, Hiawatha. Drop-off is between the hours of 8:30 a.m. and 4:30 p.m. Monday through Friday. Individuals dropping off will need to ring the doorbell, as lobbies, appropriately, are closed for general walk-in traffic. Local nonprofit, food, and nutrition providers are requesting 2,000 disposable grocery sacks to bundle meals for delivery. Please contact Heritage Area Agency on Aging at 319-398-5559. Thank you.
Good afternoon. I'm Linn County Sheriff Brian Gardner, and I've been asked to come and talk a little bit about the law enforcement perspective as it applies to the COVID-19 pandemic. One of the first things I'd like to talk about is what we're doing at the Linn County Jail to address the security, health, and safety of our staff and also our inmates. By design, the jail is really susceptible to infection because of the number of people that come and go from the building at all times during the day and night. That's both inmates and staff. And so what we've done is we've ensured that our staff is very aware of those health-conscious things they need to do to protect themselves. Hand washing, use of sanitizer, even social distancing within the facility itself. That's all very important as we move forward. We've instructed our employees, if they are ill, to stay home. We have instructed them to use the basic sanitary and sanitation methods of hand washing and also for the sanitizer as well. We are now screening all of the inmates before they have access into the building. We actually do the screening out in the Sally Port area of the building. It's the area that you get to before you actually come into the locked facility. We're screening our inmates at the patrol vehicles. We're looking for temperature. We're looking for respiratory distress, and if our inmates are showing both respiratory distress and fever, we are refusing them and then directing them to the hospital to make sure that they are checked by medical providers before we accept them into the facility. Those inmates that are allowed into the facility that do have perhaps a fever, but not the COVID-related respiratory infection, we have special cell blocks within the facility itself that are isolated from the rest of the cell blocks to deal with these people specifically. They are locked into single cells, they are isolated, and they are dealt with more securely and safely than they would be anywhere else in the building. We also proactively, with the court's permission, released anyone serving time that was already in the facility. So if they were work release inmates who come and go constantly, if they were serving time for a sentence, the court authorized us to release all of those people from custody. So the only folks that we currently have in the building literally are those that are awaiting trial, those that are awaiting sentence, and those that we are holding on behalf of the federal government. Everyone else has been released from the facility. We have stopped our contact visits in the jail. We're no longer doing the programming that we used to do, including religious services, ASAC interventions, GED, those types of processes where we brought in an outsider to meet face-to-face with the inmates. With social distancing in mind, we have stopped those programs. We've also canceled inmate visitation, where public was able to come in and meet with an inmate. And even though that was through a glass window and did not have direct contact, what we are doing instead with that area is that's now how the attorneys are meeting with their clients. Attorneys are no longer meeting face-to-face with the clients, they're meeting through the glass through visitation. So we had to cancel inmate visitation to allow for that process to occur. To make up for that with the inmates, we're now providing them with 60 minutes of free calling per week. We're providing them with additional free postage so that they can continue to make contact with their loved ones while they're in the facility. The court has now directed us that we are no longer to bring people who have been arrested for simple misdemeanors or serious misdemeanors to jail, with very few exceptions. Those folks may still be charged with their violations, but they'll be released from the scene on promises to appear. That allows us to house only those people who have been charged with the more serious of violations in the facility, and we don't have to bring in those who have the lesser offenses. We're paying attention to our partners at Linn County Public Health, at the CDC, at the Iowa Department of Public Health, and we also have a full-time medical staff in our building that we're working with to ensure the health and safety of not only our inmates but also our personnel. So we feel, enacting all of those various policies, procedures in place, that it helps to safeguard our inmates and also our staff. I was also asked to talk a little bit about what we're doing to help safeguard those businesses that have been closed. So we are increasing business checks, not only with the Linn County Sheriff's Office, but the law enforcement community in Linn County. We're increasing those business checks even at hours of the day we normally may not have, even daytime business checks for those that are closed. It looks like, from what we can tell from our compliance checks, that all businesses are complying with the governor's directive, and they are either closed for business as directed or they reducing to takeout or carry out only. I know of no business that has been charged with a violation for violating that, and it looks like the business owners themselves understand the significance of this and continue to comply with the closure or reduced service requests from the governor, actually edicts from the governor's office. One final thing, we were asked, how's this affecting the transactions between the community and law enforcement? Well, it has changed, obviously. Most governmental offices are closed. That means most law enforcement agencies are also closed to the walk-in public, but we're still open for business. We're still responding to call. We're still out there letting the public know that we're there to help make them safe. A lot of our business is now conducted over the phone, or conducted by email, or conducted through our internet websites. So we are there to continue to protect you. We are there to continue to monitor the activity and to respond to your calls for service. We'll get through this. We'll get through this together. Thank you.
I want to just briefly thank all of our speakers today and thank the viewing public. And at this time, we will open it up for questions from any of the reporters here in the room.
Supervisor Walker, we'll start with you then.
Okay.
For you and Mayor obviously, if you want to, I know you didn't talk, but if you want to answer too, just about shelter in place. I know you've been pushing for a statewide order. Today, the governor said that at this point she's not considering giving local governments the authority to issue it locally. At this point, do you still want to see it statewide? Would a local, that local authority suffice? And then the second part of that is the governor says that she's basing whether or not to issue this off 4 metrics, but she says that she has encouraged or invited local government to provide additional metrics that may prove that shelter in place is needed. Have you provided anything like that?
Yeah, so I'll just try to paraphrase and repeat the question for those listening. The question was about shelter in place, and there has been some question whether or not local governments can issue a shelter in place order. And we were receiving information from the governor herself that local governments had the ability to do it. But just recently, the governor has sought the advice of the Attorney General and has suggested that the order to, the ability to be able to issue a shelter in place would have to be delegated by the governor. And essentially, what is our response to that? So you heard it here today from one of our physicians. What we do right now is going to have an impact on whether or not we're able to flatten the curve and not overrun our hospitals. This time is really important. And one of the ways we can flatten the curve, obviously, is to have a shelter-in-place order. In this case, it would need to be issued by the governor and executed on by local governments and enforced by local governments. That would be helpful. Now, the governor has taken some steps to close some businesses, But unfortunately, right now, what we still have too many people interacting with the public. I know that Johnson County has issued a request to the governor's office to allow them to be able to issue a shelter-in-place order. And I have maintained from the beginning that it is the position of the Linn County government that we would issue such an order now if we have the legal authority delegated to us, and if we have the buy-in from two of our largest cities within the county, of course, Cedar Rapids and Marion. Any other questions?
Yes, with the metrics, has Linn County provided any sort of metrics that could persuade her that a shelter-in-place is needed?
I think Linn County has been very diligent in making the case of why a shelter-in-place would be helpful. As I said earlier in my remarks, you know, I don't want to gamble with this. I want to err on the side of preservation of life, which means I think we need to do everything we can to protect our people and to reduce the amount of cases our hospitals might see in 3 to 4 weeks. Sort of along those lines, I guess, let me just say this. I understand that there is consternation within the community, especially within the business community, about what a shelter-in-place order would do. But again, it's important to me and many others that we take these drastic steps right now so that we don't protract this crisis that we're in. You know, finally, what I would refer to is, you know, it's often said that Iowa isn't like California or New York, which are experiencing devastating consequences of the COVID-19 crisis. But we are like Illinois, and we are like Wisconsin and Minnesota and other states around the Midwest that have taken more drastic steps to confront this virus than what we have done here in the state of Iowa. And I think we need, again, to err on the side of caution and safety and do everything we can now to prevent this from spiraling out of control.
I have a question. Not sure if it would be best maybe public health or the hospitals. So we obviously knew that the cases were coming to Linn County. We went from about 3 cases, the first 3 cases, to now 71 cases in a little bit more than a week. Can you give us a little bit of perspective on these cases? I know this was something that we maybe is concerning but expected with all the tests coming back. Just wanted to see if that was still.
Thank you for the question. The question for those that are watching this at home is, we started off with just a few cases and we've dramatically increased and we're now at 71. So yes, we are seeing far more cases, and we've said from the beginning of this situation, we're going to see more cases, and that's going to continue. We're going to see more and more cases come through, and that's because of our interaction with each other. So let me talk a little bit about contact tracing. So what happens is when we have a case that is positive in Linn County, for our Linn County residents, we contact that individual. We talk to them about, where have you been? Who have you been around? Your family members, people at work, others, and then we reach out to those individuals. We give them quite a bit of education on what symptoms to look for, what you need to do if you think you're ill. And so through that process, if individuals start to become sick, they are contacting their healthcare provider as directed by the health department. And then they're seeking care, and a lot of times that will include testing. We also work with those individuals that have been positive. We call them every day right now to find out how they're doing. Is there anybody at home that's having illnesses? So again, as we are out there and we're educating and we're talking to more people, people are starting to recognize their symptoms and they go in for care. Again, this is a illness that's spread person to person. That's why it's so important when we talk about staying at home. It's so that we're not spreading this virus among others. It's not like a virus we've ever seen before, and it's so easily transmittable. Symptoms vary from person to person, and that's why we're saying no matter how mild your illness is, stay home. Thank you.
And then
Yeah.
another question. So I didn't know, I was trying to look back through my notes from the beginning. Do we know when
Thank you for the question. The question is, when did community spread first start? And I'm sorry, I did not bring that information with me. It was close to the beginning of it when we first started seeing cases here, but I don't have that information with me right now. I apologize. Mm-hmm.
And then just wanted to check on a couple things. So last week we talked a little bit about if the rate, we were seeing it double almost daily. If that rate continues, that in 2 to 3 weeks hospitals would be overwhelmed. Are we still is that still on track, or is that maybe a week or two away now with the new cases?
Well, I think as Dr. Myers very eloquently stated, if we continue on this trend, we're going to see that number continue to spiral up, more and more cases every day. I know we're seeing more and more cases every day here in Linn County. So if we don't do something now to prevent these numbers from going up, it will be a huge strain on our healthcare system. And you know, we need to look out for our healthcare providers. They're on the front lines taking care of all these individuals. We need them to be healthy. So that's why if you're not sick, we don't want you to go to the hospitals. We don't want you to go to the emergency room. We want you to stay home, take care of yourself at home if possible. We need to keep our healthcare infrastructure. We need to keep our providers, our doctors, our nurses, our med techs, our CNAs, our front desk people that are answering the phone calls. We need them to be healthy so they can take care of those that are ill. We're all in this together. Okay, thank you.
Heather, earlier today, the governor, when she was announcing the outbreak at the care facility, said that an outbreak is a place where they have 3 or more people test positive.
Correct.
At least as of last week, we had confirmed that at Heritage Specialty Care, 4 residents had tested positive. Is that the care facility that we're referring to with this outbreak?
So I don't want to name the facility as it could, that we're just not going to name the facility as that could potentially out not only a business, but also it could potentially identify individuals. And right now, when we look at individuals that are sick, when we look at individuals that have unfortunately died, we don't want to be naming those individuals. We want those families to be able to take care of their loved ones and not have to worry about hearing about it on the news right now. So out of respect for those individuals, we're not going to name them.
Well, not even naming the individual, but
The facility too. You guys have done a great job investigating, so I'll let you keep investigating that. So thank you.
Okay.
Yeah.
I have some questions.
Oh, sure.
I have just a couple of more questions on the hospitals.
I'm going to ask questions from the field, and then if we have time,
Yep.
we'll come back. So Heather, don't go far. So I have a couple questions here that are best answered by our medical and public health professionals. The first couple of questions are from Michaela Ram at the Gazette. The governor confirmed that 21 of Linn County's 71 cases are directly related to the outbreak of the long-term care facility. Can you share more details? Are these cases all residents, employees, or does this extend to the individual's family members? And are the deaths related to this outbreak? And given the outbreak, what are the next steps for Linn County Public Health? What steps are being taken to ensure the outbreak doesn't spread?
So thank you, Michaela, for your questions. Again, with the outbreak of the long-term care facility, that includes both residents and staff members. Family members have not been allowed in the care facility for quite some time. We're not going to go into numbers because, again, it could potentially identify those that are ill. We're also not going to identify where the individuals that have died, where they may have contracted that, out of respect for those individuals and their families. As far as what we're doing with that long-term care facility, we talked about that a little bit earlier. We are working with that facility on a daily basis. So the Iowa Department of Public Health, Linn County Public Health, the corporate office, and that facility are on phone calls every day together. We're going over the needs of the facility, the staff, the residents. We are have a line list of everyone that has been ill so that we can follow up with each of those individuals. We're making sure that they have enough PPE, the personal protective equipment, to protect the staff and to protect the individuals. But we're on daily communication so that we can help the facility and the residents through this crisis.
The next question comes from Brian Morelli at the Gazette. How many people do you have dedicated to contact tracing? As there are more and more cases, what is your ability to do this effectively? This is for Heather.
Thank you, Brian, for the question. Never enough would be my answer, but we are working to ramp up. So right now we have, I'm trying to think off the top of my head, 5 different individuals that are dedicated to nothing but contact tracing. We are looking at adding more individuals to that and have some, working with some community partners to bring in some experts that would also help with that contact tracing to make sure that every single individual that is ill is not only connected with public health, but we are doing that contact tracing and also doing that follow-up. And I think the follow-up with each of the ill individuals is especially important as we navigate through this crisis together so that we can help them answer any questions that they may have, make sure that their families are taken care of appropriately. But just, again, this is a community effort, and so we're working with our community partners to make sure that we can get that contact tracing done. Okay.
This question is also from Brian for Heather again at Public Health. Public Health and medical personnel, are you finding cases of people who traveled over spring break, brought back the virus with them, and so to what extent?
So the answer would be yes. We have talked to several individuals that have traveled. It may be over spring break, it may be before spring break. We know that this virus was international, it came domestically, and so we are finding people that have traveled, and we are assuming, because we cannot identify anything else, that their illness may be related to travel. However, what's important to remember is that we have community spread in not only Linn County, but in the state of Iowa. So no matter where you go within our state, within our county, you may potentially be exposed to COVID-19. Again, some people have very mild symptoms, which means that they may unknowingly be spreading this to others. That's why it's so important to practice social distancing, staying 6 feet apart and not going out. Stay home. Yes, it may be related to travel. We think it is a lot of times, but we also think it's right here in our community. We think it's when people are going to the store, when they're going out together to go somewhere, when they're visiting their friends. Please stay home if you can.
Okay, this last set of questions from people texting in. There is a question from Grace King at the Gazette and from Kate Payne at Iowa Public Radio. They have very similar questions, so I'm going to do my best to combine them. But basically, they want to know how many people are hospitalized at Mercy and how many at St. Luke's, what the hospital's capacity is for COVID-19 patients, and how many out-of-county COVID patients are being sent to Linn County for treatment, and how the hospitals are preparing for those that may be referred from smaller hospitals.
So I guess to answer, the best way I can answer this is I'm not going to give specific numbers at each hospital, other than to say we've had a lot of conversation over the last few weeks about how we've increased capacity. So I'll answer it this way. Both hospitals, Unity Point and Mercy, have been working diligently over the last several weeks to more than triple the capacity of intensive care beds and ventilator capacity. And so at this point, what I would say is we are very early, and the people that are in the hospital and the ones that are in critical care, we have not even approached what our baseline capacity is. So we have 3 times as much. Again, people were talking about how this could increase rapidly over the next couple of weeks. And to go back what Heather said so well so many times is that right now we're in good shape. The issue is what's going to happen in the next, honestly, in the next 10 to 14 days. How many people are going to get infected? Because a certain number of those that get infected are going to end up in the hospital in 2 to 3 weeks, especially possibly 4 weeks, and whether we can take care of all of those additional people that will get sick is what we're talking about. And this, I'll say it again, we have to stay home, we have to wash our hands, we have to give 6 feet of distance between each other, and we have to take care of each other, and we'll get through this. Thanks.
Quick question on that note. So some of the patients have been moved around to different wings or floors that maybe wouldn't typically be exactly. So are those floors and nurse staff, are they getting the same type of equipment that maybe the people on the front lines would be?
Yeah, things have changed so massively. So all sorts of things. You're talking about cohorting. So we have, at Mercy, we have particular 2 floors. We have one that is confirmed, one that's being tested. At Unity Point, they have a whole ward. There are donning and doffing rooms outside of those floors to get in. There are spaces that have been built so people can put on really impressive protective equipment, and then they can stay and work on that floor for a period of time and come off. This isn't just nursing staff. We have their dedicated providers that are taking care of most of those, again, so that you can decrease the number coming on and off the floor. Anywhere from, therapies to how they're getting the food in there. All of that stuff is being taken care of in just a massively different way than we have ever functioned before, in order to both keep the staff safe, but also to limit our use of protective equipment. We're okay now, but we anticipate that we will have increasing needs, and so all the conservation that we can do now is also important.
Last question. On the note of the masks, so there's a national shortfall. Obviously, the hospitals are asking for more. If a doctor or a nurse were to buy or get donated maybe their own N95 mask, would they be allowed to wear that for their shift? Or
Yes, any mask it would have to be fit tested appropriately and make sure that it's going to function appropriately. But yeah, as long as it's an N95 mask and we can fit it appropriately for protection, then we would do that. Thank you.
At this time, that will conclude our press conference for today. We are scheduled to hold press conferences every Monday and Thursday. Thank you.